Have you thought this through?
No way will that work.
Are you sure? Is there any money in that?
You'll never make any money doing that. How are you going to pay the mortgage? Just get a job.
You're going to try to sell that? Why can't you be normal like everybody else?
All right. Were your parents morons too?
The savvy entrepreneur to the rescue.
Congratulations. That really turned out well.
Really good job.
I'm really admitting. I'm surprised.
You know, I wish I thought of that.
I never thought anyone would bet. How did you do that?
I'm so glad you're pursuing your dreams. I wish I had the courage to follow my dreams.
Hello there, everybody. Welcome to the Savvy Entrepreneur Show. We're broadcasting here on WLCB 101.5 FM, based in the greater Chicago, Milwaukee area. If you're an entrepreneur or a small business person or thinking about becoming one, this show is for you. I'm Doris Nagel, your host for the next hour. I'm a crazy entrepreneur myself, and I love helping other entrepreneurs. I've counseled lots of startups and small businesses over the past 30 years, and I've started or helped start at least 9 different businesses, candidly with varying degrees of success. The Savvy Entrepreneur Show has 2 goals: to share helpful information and resources, and to inspire, to make your journey as an entrepreneur faster and easier, and maybe just a little bit more fun. To help with that, I have guests every week on the show who are willing to share their stories and advice. And this week's guest is Dr. Asha. She's the CEO and co-founder of a company called Frontline Medical Technologies, and she joins me by phone all the way from the province of Ontario, Canada. Frontline Medical Technologies is a medical device company, and they have developed, with Dr. Parekh's help, a product that's called Cobra OS. And I don't really know much about what that is, but I know Asha is going to fill us in. What she says about it is that it's the smallest device ever to stop aortal bleeding. It allows frontline medical personnel to save more lives by controlling patients' bleeding in fewer steps and therefore hopefully decreasing potential complications. Dr. Parekh, or Asha, as she says we can call her, has a PhD in biomedical engineering from Western University with a specialty in biomaterials and medical devices. She has several patents and publications and has secured several grants and funding for her projects. Additionally, she's dedicated to inspiring the next generation of women in STEM. And STEM, for those of you who have been living in a cave somewhere, is science, technology, engineering, and mathematics, and changing the fact that women account for less than a third of those in those careers. She notes, too, that on average, only 19% of the leadership roles in the MedTech industry are held by women. And similarly, only 10% of healthcare startups are owned and or founded by women. She frequently shares her experience with students to inspire women and girls to explore STEM. And in her spare time, she says she enjoys playing and watching soccer and F1 racing. That is very cool, Asha. Thanks so much for being on the show today. Welcome to the Savvy Entrepreneur Show.
Thank you so much for that great introduction and for having me on the show, Doris. I'm very excited to be here.
Well, I'm delighted you joined us. I think the natural place to start is to tell our listeners just a little bit more about your business. Talk more about the device that you invented and what it does and why you invented this.
Yeah, thank you for that. You know, as you mentioned at Frontline, we have developed the smallest REBOA device, and REBOA is an acronym that may sound complicated. It's resuscitative endovascular balloon occlusion of the aorta.
Oh boy, that's a mouthful.
Yeah, and it's really just a fancy way of saying you're blocking the aorta, which is the main blood vessel that carries blood from your heart to the rest of your body. And so this procedure, REBOA, is used in emergency situations such as trauma, whether it be in the civilian setting or military setting, also postpartum hemorrhage cases, among other applications. But basically, so the REBOA device itself, which would be our device called the Cobra OS, which is also an acronym, but anyways, too is going on here.
Thank
But
you. Thank you for that. Thank
Yeah,
you
yeah.
for sparing us that. But I'm sure it's very meaningful. I'm sure for people who are physicians and emergency medical personnel, I'm sure they know exactly what it is.
That's right. That's right. And the device itself is a tool that is used to do exactly that, to block the aorta. It's specifically for hemorrhage. So if you're bleeding out in the torso region, you can't compress that area, like your internal organs, and effectively stop bleeding as you could if it was on an extremity like your hand or your leg.
Oh, yeah. So you can't do a tourniquet
That's right. That's yeah.
on
You
your
can
torso.
try, but it might not be very effective, and that internal bleeding would still be going on. So when you block the aorta, it actually prevents the blood loss through that injury site, wherever it's happening. And the other key thing is that it ensures that there's continuous blood flow. Whatever your heart is pumping reaches your brain and your heart, because those are the two vital organs to keep you in good standing. So that's the whole, theory and premise behind doing this type of procedure. And it is temporary, I must say. It's not like you want to block blood flow from the rest of your body indefinitely. This is a temporary measure to allow patients to get to definitive care. Because Doris, if I tell you the statistic, it is crazy that if you're outside of a hospital, there is a 10% chance that you'll make it if you have that type of hemorrhage, that you'll actually make
Oh
it.
my goodness.
90% of patients will bleed out before they even get to definitive care. They can't even get into the hands of a surgeon. So it's alarming. It's a large amount of people that, that are unfortunately suffering from these types of injuries.
So I mentioned in the introduction with the information you sent me that it avoids potential complications. And I guess obviously one potential complication is you don't make it, but are there others? Brain damage? I mean, I don't know.
Absolutely. So complications of not having this type of device, absolutely. The deficits unfortunately come in when there's blood loss to the brain and the heart, cardiac arrests and all these other unfortunate things that can happen in those situations. And the other complications that we were talking about, in terms of decreasing complications, is actually for the procedure itself. Currently, with the technologies that are available, it is very hard. It is difficult, I should say, to perform REBOA outside of a hospital. And interestingly enough, right now, it is being done in some places, but majority of these cases are actually being done inside a hospital. So you're already in the hospital and just trying, again, you're still the same premise. You're trying to buy time, maybe to get from the ER to the OR and that type of thing. But, you ask the question why we did this. And we wanted to target those broader areas and get out into the field and give those patients, the 90% of patients, at least a chance at survival. Let's make it easier. Let's try to overcome the current complications that there are. Let's, overcome those challenges and see if we can get something into their hands that is a little bit more suitable for the field.
Well, I'm sure with your background, you could have invented a number of different things. How did you decide to focus on emergency medical procedures and devices?
Yeah, that's a great question, Doris. And there are many factors that went into that. And I'll tell you, you're right. I've worked on several different projects, medical technology projects, but none of them really encompassed everything as a whole that I would want to dedicate my life to. That's the easiest way I can say it. Nothing checked all the boxes the way this one did. And, some of the major ones I'll tell you that was very important to myself and my business partner is the impact. This has obviously the potential to have a very high impact on people's lives, their families, communities, so on and so forth. For me as well, I've always enjoyed and wanted to be doing something where I really felt like I was helping people. And this definitely checks that box. And the last thing I'll mention, again, there are several, but I would say one of the most important, perhaps the most important, are the people that you're doing this with. And my business partner, is a vascular surgeon by trade, but I will say openly, he is one of a kind. He's not a stereotypical surgeon, if I may say that out loud. And, that was a very big part of my decision, because that has a huge impact on everything, as I'm sure you can understand in any job, whether it's your own company or working for a company. The people that you work with plays a big role in your own personal happiness and success.
Yeah. I mean, obviously, we could do a whole show on finding good business partners and what makes good business partners. In fact, I might just do that. But yeah, you can have a great idea, but if things with your business partner don't mesh, then that creates a whole bunch of other challenges. So how did you talk about the process of how you decided to start the business? When did you start it? And I guess there's probably a lot of pathways that you could take a device that's invented. You could try to license it to one of the big device companies. I don't know. There's probably other ways to think about that. So talk about the process of founding the company and how you went about that.
Yeah, great question, because you're exactly right. And in some of these other projects that I've worked on, we've done exactly that. It's you invent something, there's an innovation there, we filed patents, and if that's the end of the road, that's fine for it. Or if there's a company that wants to take it on, also fine with it. But again, like you said, this commercialization pathway and starting a company is a much larger commitment. And again, it was because this project itself checked all of those boxes. And I will say, if I can narrow it down to maybe the highest thing on both mine and my business partner's list, is that impact. We saw and really felt the need to get it out there and commercialize and put something like this into the world, where we can, try to at least affect some change and help try to save people's lives better than it's being done today.
That's certainly true. If you license an idea, you certainly have less control over whether anything really ever happens with it and what happens with it and how it's developed, right?
That's right. Yeah. So it was over 3 years ago now, we received a bit of startup funding through this program that was run locally. And that's really what catapulted us into the serious conversations about what it would take and, putting a real effort into moving this forward, because, for one, we both had our day jobs, and this was kind of something we were just doing in our spare time type of thing. But, to really put effort into it, we said, are we going to actually do that? And so that is when I took the leap into entrepreneurship, and, this has been my full time ever since. And, we took that plunge and said, let's get into the world of medical technology commercialization, which I know, is not a small or a short journey, and the path to market itself is quite long, but, thankfully we've never had to look back.
Well, that's great. So you mentioned a local program. Was that kind of a local accelerator program that helped you gain confidence to make that jump?
Yeah, it was, I would say the funding was a factor. The program itself wasn't a typical accelerator. They did have some sessions to help with startups, on certain seminars on, say, like intellectual property and things like that. But it was really the funding that got us going. And it was a mix of government funding and a local organization. So it certainly got us thinking about incorporating sooner than we may have. So, I lend the credit to that for sure.
Yeah. So what does the pathway look like? I mean, where are you and what needs to be done next? And where are you looking to market this product and how?
In general, medical technologies, depending on the class of the device, can take several years and several millions of dollars to just get to regulatory approval. As you know, we can't just start making something and sell it. And obviously we understand it has to be safe and effective, and we want it to be safe and effective. to prove that takes a long time. And I will say that we are thankfully at the point where we are ready to enter the market. We are starting in North America first, and then we will expand. So, Canada and the US will be our first markets. And the field of REBOA itself, I will say, is still an emerging market. So it's not a very established field. And, that makes it a bit challenging, but it also makes it exciting.
Yeah, the ability to make an impact for sure. I mean, I'm just thinking, even if this is not a procedure that most emergency medical personnel have performed, there's going to have to be a fair bit of training, right, for folks to be able to use this effectively.
Yeah, it's a great point, Doris, because in the design and development of this, that was a very big consideration for us. The whole point was to make it as user friendly and as easy and, facilitate that part of it. So there certainly will be a component, especially for people that have not done it, to learn. But as people in the medical field often have to do, there may be a small training component required there, but we do believe that we have lowered the barriers to have this done by expanding the type of professionals that can do it beyond surgeons in the hospital.
So talk about some of the challenges you faced in getting started. It's a big leap into entrepreneurship, particularly in healthcare in general. So talk about some of the challenges you faced and how you dealt with them.
I think that we've been fairly lucky from a company level and on a personal level as well. But obviously there are always those, hills or roller coasters, as they say, of entrepreneurship, of the high and the lows. And, yeah, we have been pretty lucky, but I will say, there are some things, being a small company, for one, we kept it lean and tried to keep our organization small. Again, at first, considering funding, and also the workload is very different in a startup. You may have a lot of work to do at some times and not so much at other times. So, hiring is also something that, that factors into all of that. And so I think one of the things that has stood out is finding good partners and people, again, going back to how important the people you work with are and those relationships, and finding good partners. It is one thing to find a good employee, again, and timing is one thing, but even finding outsourced partners is not always easy. Like I will say.
Right. And you do need to have a lot of flexibility, because what you need today in terms of an employee, a full-time person hired, may change over time. So that makes it even trickier, right?
Exactly. And so, we have gone through, a couple of bringing outsourced people on, as consultants or agencies or whoever. And, we have gone through a couple of them and had to do some quote unquote firing of them, but it's a lot easier to fire them than it is to fire a full-time employee. So, not to say we haven't gone through some changes there. Those are some things, but overall it is ultimately, like you said, finding a good partner, but a good partner at the time that you need them and at those stages. So that has been something we have dealt with along the way. And, I again, touch wood, we have been fairly lucky in every other regard. So,
well, yeah, you need to, as a startup with a brand new device, I mean, you need to think about the marketing of it and how you're going to find customers, but you also have the manufacturing piece of it too. So I'm guessing you needed to find an effective manufacturing partner too.
Yes, absolutely. And that was not easy either. But yeah, it was definitely a very large, a very important and big partner.
Especially because medical device manufacturers are heavily regulated. I mean, it's not like you can just stroll down the street and find your local tool and die company and, let them go try to make a prototype.
That's right.
There are only certain numbers of companies that have the regulatory approval and the quality systems and everything else that you need to have to produce a medical device.
That's correct. Yeah. So those are things that, like you said, they're required for the field. So we've had to check those boxes and carry along. I think from that end, we have been lucky and we found a good manufacturing partner. I think this past year and a bit now, the pandemic has certainly had an effect on a lot of people. And we, again, are thankful for where we are and where we've come, but haven't been able to avoid every delay possible, to say the least.
Yeah. Well, and there are, I do know that shipping and logistics has been affected. And so
That's right.
you need somebody to not only manufacture it, but you need to think about how you're going to distribute the product too in a way that's cost effective but timely. I know healthcare systems in the US are very focused on, they don't want to keep a lot of inventory of things. So that means you need to be able to deliver it, not exactly just in time, but maybe pretty close to it.
That's correct.
So what's been the single hardest thing so far for you in becoming an entrepreneur?
Well, I would say that the hardest has also been the best, and that is that I have never done this before. So it's been an education on its own, which is amazing, but also very hard. So, there have been a lot of learning experiences. I'm not, a seasoned entrepreneur, as you might say, but I think that is, again, I like to use that as inspiration to a lot of people who are scared to do it and say,
Yeah,
just because you've never done it, it doesn't mean that you cannot.
right.
We built this from the ground up, and you really feel like part of those rewards are the ownership that comes from it. It's everything that has gone into this. You've literally done yourself. And, it is hard to learn a lot in every facet. So as a start, it was just myself and my business partner at first, and we had to learn everything from how to take that product to market on the manufacturing development side to regulatory, quality, finances, everything, intellectual property, corporate legal things, like things that we've never dealt with. So again, it was hard, and it has, but it has been amazing at the same time.
Well, so how do you find effective resources, and what advice might you offer to people in terms of finding those partners and finding the help that you need?
Great question. I will say what I've learned over the past few years in that regard is that, I just always ask people, ask who you know. And in terms of finding good people, because we've had to kind of, just shoot aimlessly sometimes and look for people, like, even Google searches.
You don't strike me as a very aimless sort of person.
Yeah, I
It's
should
all
say
relative, I
aimless.
suspect.
Yeah, with a target in mind, but maybe, not necessarily knowing. We're just trying to find people on our own. But I have found that the best relationships and the best connections that we have found have been through referrals. So, go to your people that you know and continue to ask for any recommendations, other people that have been through it that may say, yes, actually, I know somebody who'd be really good for that, instead of just trying to find people on our own. That is something that now I will, not to say, if you don't have a choice, you don't have a choice, but if we have the option for a referral and somebody referred or an agency referred, then we will try to go down that route first. At least there's some credibility from someone there. And that, again, goes back to who you're asking, then they should also be a credible source.
Well, so you're making the argument pretty effectively for network, right?
That's right. Absolutely. Because again, it goes back to people, right? And having, I'm not have a huge network person. I have a quality network is more what I strive for.
Yeah. I think your experience is certainly, it squares quite nicely with what other entrepreneurs tell me week after week. So I think your experience is right on. Where do you find inspiration when you hit a speed bump or a little wall?
Yeah, I will say two things. One it always goes back to that impact, the drive that, we want to get that out there again, on a company level and personal level. Me, it's like, I really want to help get this out there. So, if it's hard, push through, keep pushing, do what you need to do, because this has to get out there. So impact would be huge. And, on a personal level, I have to say this. If I think I'm going through a hard time, or there's something that's personally tough for me to do, I often think about my business partner, because he is not only a full-time surgeon, also does this, in a capacity I have yet to comprehend how he can do it. But, amongst other things, in life, and it really, I think the support is what I'm trying to get at. Also is, having that support. And I look at everything that we can accomplish together, and I do drive inspiration from his drive as a person. So those would be the two things, is just, really wanting to affect change in the world, which may sound cliche, but it's really true. It is something that really drives me, and, having an exceptional partner.
Well, I think those are having an overall purpose, something you're passionate about, certainly helps most entrepreneurs. I think that's another theme that I would say has been very consistent in all the people I've talked to is, when you have that vision, that overriding vision, staying focused on that and continuing to draw inspiration from it helps most of us get through those rough patches. I know one of your other passions that we chatted about before the show is helping encourage more women in STEM. And again, for those of you who have heard the term STEM but not sure what it means, it's science, technology, engineering, and mathematics. The numbers are pretty depressing, particularly in medical technology and healthcare. I mentioned in the introduction, you had shared with me only 19% of leadership roles in the MedTech industry are held by women, and only 10% of healthcare startups are owned or founded by women. And Asha, I don't know if that's a Canadian only statistic or North America, but I know the numbers, no matter which ones you look at, are shockingly small. Why is that? I mean, the majority of nurses are women, and lots of physicians are women these days. So what's the story there, do you think?
Yeah, I think there's a few things to look at. One is the actual STEM portion of it, which, as you said, is the science and technology and the actual technical part of it. And the other I almost separate them in my mind, because that is very different. Like encouraging, which I do, as you mentioned, encouraging women to get into STEM to begin with is one thing, but a woman in STEM already getting into like a corporate MedTech job is a different ballgame almost, having that ownership or co-founding a company or those positions. I think those roles entail a different angle as well. So it's a little bit of both of those worlds coinciding.
Yeah, I agree with you. And I think it's good to separate the two. So let's talk about women in STEM in general. I mean, I've concluded there must be things that happen at a fairly early stage of development, because as far as I know, there's really not many barriers. I mean, when you go to college or university, women are free to choose to be a communications major or a math major or a computer science major or a journalism major, right? I mean, nobody says you're a woman, you can't be a math major. So something else is happening to pre-select women from choosing those paths.
Yeah, that's a great point, Doris. And I fully agree with you. I think it starts from a very young age. And I think the influencers on those decisions are many. Again, some potentially controversial topics, but even from parenting to school environments, social environments, all of those things. And I think every place slash person, has its part in where people go. And I think there are, cultural things at play here as well that, kind of direct you in ways, even if unintentionally. But I do think that the influences come from many directions.
You've thought about this a lot. Give some examples of how an event or encouragement or lack thereof might affect the course of someone's career.
Yeah, I will say from personal experience, I am thankful to have parents who encouraged us to do what we wanted to and not necessarily pushed us in any way specifically. But I do know, in contrast, some friends that I'm of an Indian ethnic background, and I will say, me growing up with those types of parents, particularly, again, I'm focusing on this one thing as an example, but a lot of people of Indian background, they do get a lot of pressure from their families to go into the medical sciences, engineer. You always hear like you're an engineer, doctor. Those types of fields are the ones that Indian people tend to go towards. But I think that's why I notice the difference. And I can see, to your point, where if you are pushed into that way, and it may not necessarily be your own passion.
So you mean inadvertently, parents, by pushing their children, their young daughters, into sciences, may actually inadvertently turn them away from it because they feel like they have to, as opposed to something they want to do? Am I understanding you right?
I do agree with that, Doris. I do agree with it. And, there's also the part where every individual is different. So an individual, I can think of people right now in my life, an individual that may have been in that family and cultural situation that moved towards STEM for, probably a bunch of reasons, but, also had that influence from the parents. They may be completely fine with it because they're the type of person that will carry on with their life with whatever and not necessarily reflect on it. Whereas another person I know has also had those influences, gone down that path and not enjoyed it, reflected, and have realized that they made these choices for maybe the wrong reasons, not entirely because it's what they wanted to do. And that can have, a great impact on your life, as I'm sure you can imagine.
Oh, well, it's interesting. And there may be cultural factors here. I'm just thinking my daughter just graduated with her bachelor's degree in statistics. So she is a successful STEM story. But, I'm Caucasian, and she jokes that she's a very small minority. And in fact, watching the graduation ceremony, first of all, there were fewer women, a lot fewer.
Right.
And without sounding stereotypical, there were a lot of the women who were there were mostly of Asian descent, different Asian ethnic origins. But, she joked, she goes, "Oh my God, there's one more white woman." And so, I found the whole thing kind of appalling because I guess I thought that somehow, since I went to college, because I saw that many years ago, but I thought it must have changed a lot by now. And yet it hasn't. It just makes me wonder, what is it that we as parents are doing or not doing to encourage our children of all different ethnic nationalities and different kinds of backgrounds, to encourage women to, to really consider this?
Yeah. And I think, we had touched on this previously as well. I think there are some inherent biases towards women, even in this day and age. I think it's unintentional, but people and parents they don't even realize what they're doing to treat their daughters differently than sons. And you can't affect change if you're unaware, right? You can only do something about it if you're aware that it exists and will actually
Right.
moving towards that. So,
Right.
I think there is something there around awareness and educating people in being mindful of our behavior towards women, and, even unintentionally doing these things.
Yeah. It's interesting. Someone I was chatting with not too long ago said that there's a study out there, and I need to go see if I can find it, that says that someone was studying the reactions of parents with their children on the playground. And that even at a very early age, 3, 4, 5, 6 years old, parents of daughters were more likely to say, and this is mothers and fathers, were more likely to say, be careful, and more likely to say to their daughters, and more likely to say to the boys, oh, wow, look what you did.
Yes, and that's a great example of exactly that, right? Same behavior from a daughter and a son, and what a drastic difference in response.
Yeah. And that's probably a good segue into the other half of the equation that I think you rightfully made the distinction, which is first encouraging more women to consider technical fields where there certainly is a need for more women, more women's perspective on things. But then, as you say, to actually become an entrepreneur or a senior executive in a company where you can influence
Mhm.
how things change. So what happens there? So there's now, I think your statistic was maybe less than a third are women in STEM. Less than a third of the candidates in STEM fields are women. So you would expect to see, though, a third of the women holding leadership positions in healthcare companies or being founders of startup healthcare companies. So, what happens in that next step, do you think, to make the statistics drop off even more?
Yeah, I think there's a big portion of that is also, as we evolve. And thankfully, again, I have to say, I do think that we are moving in the right direction, but there's obviously a lot of space to still work with, and which can be seen by those numbers. But I think there are factors that play into that, such as, because those are personality things in terms of confidence and having the confidence to be in those type of roles. I do think that that's has, again, going in the right way over generations, but typically females were not in these roles, and it has been traditionally the males that have been in these senior roles. And there's a shift, and once there's always a curve and an adaptation and adoption curve, and as we go through this transition, I'm hoping that it continues to close that gap. But I think that it still does play a large role in it because of all these influencers that we talked about, including parenting, school, social, environmental, to allow females to even feel like it's okay to develop that side of them.
Also, if you ruled the world, what would your vision be in terms of what we need to do as a society in North America to accelerate that movement? I mean, what kinds of things would you advocate for?
Education around awareness from everyone. Again, I wouldn't pinpoint it on any one party, but all of the influencers, from parents to schools to all of these environmental things, how everyone, needs to be aware of it. I will say that I do want to be a little bit careful because I am in it and I try to advocate and help and inspire people to get into STEM, but I'm very much someone who believes in we need all kinds in the world. I would
Right.
never want to be in that power,
Right.
position that you talked about and try to get everyone into STEM. So
No, right. I mean, we need artists too, and we need writers, and there's already a lot of money at the universities that flows into engineering and computer sciences. I mean, I went to my daughter's campus just as an example, and there's all these new buildings for engineering and computer science, and the poor English building looks just as dumpy as it did when I went to school.
Yeah, exactly. Yeah, I do believe that, we need to encourage people to do the things that work for them as well, and not just, kind of try to point them in one direction only. So just to make that distinction, but again, being in the field and wanting to help the people that do want to be in STEM or be in those leadership roles, I think the education and awareness can go a long way. And again, it's not something that can happen overnight, but I do think that it can happen.
Well, I'm curious whether you've experienced more challenges or different challenges because you are a woman and or because of your ethnicity. Do you feel that that's been a harder road for you, or just really not something that has mattered?
Yeah, I will say I do feel pretty lucky that, and everything's relative. I may think something's a lot and someone else may think it's, not, and vice versa. However, I was born and raised in Canada. I don't feel like I've experienced a lot of discrimination, but I think it also, mindset plays a lot into it. Like maybe it's me that I could have been discriminated against a lot and maybe not even realized it, but I've never felt that I didn't belong. I will say on a professional level, being in engineering is still very male dominated. So I have been exposed to that for several years since, undergrad. And there are times where I find myself being still the only female in a room or the only female in a conversation. And I don't always notice it even, but that I have experienced on several occasions times when it has been hard to be heard. It's hard to get listened to. And that the reasons behind that can go from not being even given the opportunity, you're not addressed in the conversation. And there's been times where I've tried to get a word in and I just can't, like, it's hard, you're overpowered. And that's not always the case. Again, it's been select few times that I can remember. And unfortunately, there are people that will still default to a man over a woman in the room.
Yeah.
No matter what, that's their default, and they will do it 100% of the time, again, maybe without even realizing it. But that goes back to those influences that we talked about, how they were raised, where they were raised, all of those influential factors. And I mean, of course, this is very group and person dependent. Not all men are alike either, right? There are some very
absolutely not.
Yeah. So that for sure. Ethnicity, I can honestly, Doris, I can recall one incident growing up that, I was, and it wasn't here, it was in the UK, but where I really realized, there was a comment made about the color of my skin. I never experienced it beyond that growing up. So again, I do consider myself lucky there. And as an adult, I have not felt that. And whether somebody has had that bias towards me or not, it either has not been blatant enough for me to realize it, or I don't take it into consideration enough to, have it impact me. And I don't want those things to impact me. So I'm very thankful for that. And
I think you're right. I think sometimes ignorance might be bliss. And I think sometimes, mindset is important. You remind me of one of the guests that I had on my show a few weeks ago, who is a venture capitalist, and she's experienced a lot of the same things. She's the only woman in the room. And she said, a lot of it was very weird, but I didn't care. I just knew I was going to keep showing up. And eventually they realized I was going to keep showing up and I was going to make intelligent comments. And over time, they just, realized, okay, that's her and she belongs here, and okay. So I think, what you're suggesting is probably not atypical. It's just, you need to have enough self-confidence and enough passion about what you're doing that you just keep showing up, right?
That's right. You just keep doing it, and again, like you said, if you're contributing and have the, ability and show that you're meant to be there. Hopefully people will realize that, even if it's not at first, then eventually.
Well, good. I'm glad that you keep showing up, and I hope more professionals like you keep showing up. Looking back, what advice would you give from your entrepreneurial journey? What advice would you give to other entrepreneurs, maybe especially women entrepreneurs, but entrepreneurs in general, about starting your own company and growing it?
Yeah, and I would say exactly that, really, in a nutshell, is what we just talked about, is keep showing up, keep doing it. If I was a motivating voice in my head from, my journey, I tell myself to do exactly that. Keep moving forward, find a way. If you don't know something, learn it, figure it out, talk to people, find those resources to make it happen. Just because you haven't done it, like I'm a prime example, doesn't mean that you can't make it happen. There are inherent risks in doing that, as everyone can probably comprehend on some level, but you have to continue to be open-minded and be prepared to take some risks. I think just keeping that momentum and pushing through the highs and the lows is the biggest thing. You just make it happen. Another thing I would say is, it might sound contradictory to what I said, but as I was saying, to talk to people and that, but it's a little bit on the other side, is don't listen to everyone. There are some experienced people that can give you advice that's not suited for your particular company or situation. And I think that because, I was in that situation, as I said too, is that I've never done it before. So you lean on people, but it doesn't mean that they necessarily know the best course of action for you. And, you don't always have to follow a normal path. There are typical things that people can lay out for you for, I don't know that there's such thing, but, a typical medical device company, but that's not necessarily the right thing for you to do. And I will say that, we've been in situations like that as well, is that it's like, stand up and push for what you believe in. There are situations where people are going to say, no, 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 this is the norm, or, you should do this. And it's like, really? Like, I think the reflection and questioning those things is very important. Even talking about fundraising briefly, those decisions shouldn't be taken lightly. And I think for a lot of people who are in startups, and particularly like myself, in situations where it's their first time, you sometimes feel like you have to listen to the people that have done it before, even right? Like the venture capitalists or people that go through these, they're like, oh no, we only do this. Okay, well, great. Like, it's sometimes hard to resist. And I'll use that as the example, because if you need money, which you can't run a startup, especially a MedTech startup, without funding, if you need money and they're dangling something in front of you to give you, I don't know, I'm going to make something up, like millions of dollars, but they want to take 70% of your company, you may feel like you have to do it because they're like, it's the only way you're going to be able to do it. And I would say, just challenge yourself, a challenge to think beyond that. If you don't need to, it may be the right decision for you, maybe, but don't necessarily listen to all of that. I think that's a big thing.
It's interesting. One of the venture capitalists who was on the show a few weeks ago, I thought had a very good observation, who said, don't take every piece of advice and go run and change your business plan or your approach, because otherwise you're going to spend all your time pivoting.
That's
What his advice was, he said, talk to several. And if you hear the same thing over and over again, or 3 or 4 times, stop and think, because probably there's some kernel of truth in there. But don't knee jerk, because lots of people are just offering advice. And I laughed and I said, it's like when I was a new mom, everybody in stores would just come up to you and say, this is how you should do this with your child. You shouldn't let them do this. You could drive yourself completely nuts trying to listen to each and every person and their advice. But as you say, be measured about it, consider it. It sounds like, also having thick skin a little bit, Some people aren't going to be wildly enthusiastic about what you're doing based on their own personal experience. Sound out lots of different people, right? And if you hear the same theme over and over again, maybe
Right.
there's something to it. You might listen, reconsider, maybe just say thanks and move on.
That's right. I love that analogy because, we do often think this company is our baby. We call it that a lot. No, no one knows better than you really to be able to at least assess those things and do what's right. So, that's a great point. And yeah, and the last thing I will say, and I touched on it earlier too, is choose your people wisely, from your project team to partnerships. I do strongly believe it has a huge effect on a personal level and on a business level. Your passion that we also talked about, that delivers on the outcomes of what happens, of your successes, and the team of people behind a company are crucial to its success. And personally, day to day, even if you think on a daily level, to everything, your own happiness, surrounding yourself with the right people, I think is vitally important. So that would be a strong point of advice from my end.
Well, I think that's great advice as well.
Mhm.
One last question.
Yes.
How should people reach you or the company if they're interested in learning more about the product, or maybe they're just looking for advice or something we touched on today?
Yeah. Thanks for that, Doris. I would say, our website is definitely probably a good starting point for the product, which is the website. Our website is www.frontlinemedtech.com. There is a contact form on there if people would like to get in touch with the company. And for anything else, LinkedIn, my LinkedIn profile is a good way to reach me personally. If anyone would like to talk, I'm happy to share more experiences and talk about anything at all. The website and LinkedIn would probably be the best ways.
Why don't you spell your last name just so?
Yeah, I was about to do that. Yes, so thank you for that. My first name is Asha, Asha. Last name is Parekh, Parekh. On LinkedIn, it should be fairly easy to search for that name, and it will show the Frontline Medical Technologies in my profile.
Fantastic. Asha, thanks so much for being on the show this week. I really appreciated your insights. It was great having you as a guest. So thank you again.
Thank you so much, Doris. It's been a pleasure, and I really enjoyed our conversation, and thank you for having me.
A special shout out again to my guest today, Dr. Asha Parekh, CEO and co-founder of Frontline Medical Technologies, who joined us this week to talk about the new medical device she's invented, as well as the topic of how to encourage more women in sciences and technology and entrepreneurship. You can find more helpful information and resources on my website, globalocityservices.com. Because the show is for you, my door is always open for comments, questions, suggestions, or just to shoot the breeze. You can email me at dnagel, Nagel, @lakesradio.org, and I promise you'll always get a response from me. Be sure to join me again next Saturday at 11 a.m. Central, noon Eastern. But until then, I'm Doris Nagel, wishing you happy entrepreneuring.